I'm going to call this Board of Health meeting to order. All members are present, including our Assistant Health Coordinator, Chris Schultz. The first item on our agenda is the COVID-19 update. I'm going to turn it over to Chris to talk about that.
Okay, so just real briefly to address the change in seats, let the board know that I have taken the position of Assistant Health Coordinator in the Health Department. I started on the 1st, and I resigned today from the Board of Health. So I want to thank you guys for being a great board. I want to thank the residents of Abington who voted for me for voting for me. And I apologize for stepping down, but it's a new role. So on to our COVID update.
Chris,
Yes, I'm sorry.
thank you so much for your service.
Oh, thank you.
I think honestly, the town of Abington, now that you're in a full-time capacity as opposed to a board member, I think they're very lucky to have you. You're going to do a great job. I just want to say thank you. You were the president when I joined the board, and your support to me meant a lot. So.
Well, thank you.
But I'll stop interrupting you now.
And it looks like you're not getting rid of me, so
Apparently not.
I'll be doing this for a bit. Okay, so for our COVID-19 update, as of 11 a.m. this morning, we had 40 active cases in Abington. Our test positivity rate is at 2.93%, and that seems a little low based on our current numbers going up, but just to remind people that the positivity rate is a 2-week rolling average. So we'll probably have a new number around Thursday. That's all I have for COVID.
Okay. Any questions from the board for Chris, the COVID-19 update?
Question for myself. I know our last meeting already had talked about the idea of trying to get the ages into different age categories. And I know he said that we were waiting, I think, for the state to roll that out. Have they rolled anything out yet, or are we still waiting on them?
We haven't, I believe the school department is releasing their weekly numbers, and that may have more of a breakdown, but ours, we still just have the total numbers.
Business as usual.
Yep.
Okay. Thank you, sir.
Chris, has it been any type, has it been, school children bring it back, unvaccinated children bring it back to the house? Or, and then infecting the whole house? Has there been any trends as far as the infections of COVID-19?
I don't have any hard data at the moment, but we haven't identified any community spread at this time.
Okay.
Is that vague enough?
Any other questions from the board on COVID-19 update?
No questions?
Moving on to our vaccination efforts update. Chris, back to you.
Okay. So currently, Massasoit College is doing a COVID-19 clinic. We have flyers out. I think we've sent it out on social media. It should be on the, I don't know if it's on the Board of Health's page, but I think we've linked it on the Health Department's page. Boosters are still pending approval by the Mass DPH. So at this time, there are no boosters available. As soon as we can start giving boosters, we'll do so. We'll do our best to schedule local clinics. Townwide percentage of eligible at this time is 67.75. That's for the booster. Also on vaccinations, Pfizer just released data today. Results are in from their first pivotal trial of COVID-19 vaccinations in children under 12. The participants 5 to 11 years of age, the vaccine was found to be safe, well tolerated, and showed robust neutralizing antibody responses. The company plans to submit that data to the FDA, EMA, and other regulatory agencies around the world as soon as possible. Results in children under 5 years of age are expected as soon as later this year. So this is kind of big news as far as that goes, and that may hopefully move up our timelines for shots for that age group, but we're still anticipating no earlier than middle of October would be the earliest we'd see vaccinations for 5 to 12. That's all the update I have on COVID-19 vaccinations.
Have we seen any, uptick in people getting vaccinated, or has it been pretty stagnant? It was 50 a day, a week or so.
Yeah, I think our total at the moment is 58% of eligible in town have both shots. There's been a slight rise. We haven't. We just had a small clinic at the senior center the other day. We haven't been doing the large-scale clinics we were doing earlier. So,
Did you have dates on the Massasoit? clinic?
It's this week.
Okay.
I can try and pull that up.
Right.
I think you have
How many of those 40 people are kids?
we don't have that information.
So they could all be senior citizens? Just, I guess?
Or they could all be kids. We don't have that information. That was one of the questions that we do have pending on our side, is how they're going to release age breakdowns. So it's a good question, though, one that we've been discussing last week as well. I think what we could do is maybe finish the discussion with the board
Yeah,
and then open
that's
it up.
what I was about to get to. So we're going to finish our discussion, and then I'm going to ask if you do have comments, please come up to the podium, state your name and address for the record. Thank you.
I do apologize, we didn't announce that on the front end. Obviously, everyone's here because they have questions, but we will open it up for the meeting.
Yeah, we grouped these two agenda items together, which is why I waited for that. So I apologize for that lack of communication on that.
And I'm sorry, I felt from the
That's okay.
President.
So to answer your question on the Massasoit vaccination clinic, that's Wednesday, September 22nd from 12 to 6.
Thank you, Chris. Any other questions from the board on vaccinations here? Chris, did you want to mention anything about flu?
Yeah, it's probably worth
vaccinations while we're at it?
mentioning. We are doing flu clinics. We will be offering them, I believe, every other Thursday at the senior center. Lindsay Wright will be there. That's her usual time there. And then we will be doing appointments at Town Hall, I think on Mondays and Wednesdays from 9:30 to 11, and then again from 1 to 3:30. And you need to register ahead of time for that. That link went out through Constant Contact, and if it's not up on the Health Department's Facebook page, I'll make sure we get that up tomorrow as well.
Question on that, please. Are those flu shots free, or is there a cost?
Yes, they're free, and we have two. We have the one, the general population flu shot, and then we have the one for 65 plus as well.
And do they need to show insurance cards or anything like that?
Yes, yeah, you bring that information with you. You may be able to do that when you're registering. I'm not sure. I haven't tested that out.
Last question for you. Just some logistics. I know, like, I'm hearing from people at the hospitals, they're starting to see staff shortages for our Abington clinics with Lindsay and such. And this is just a finger on the pulse. How are we doing with staff? Are we kind of shorted on staff? I know there's been a couple calls for boards of members to show up and volunteer.
We're doing pretty good. The nice thing about the flu clinics is it's stick and go. You know, with the COVID, you have to have a 15-minute wait period afterwards. With the flu, you just stick them and they go, so that makes it a little easier. We haven't had to pull anybody in. I think generally if the board is seeing an ask for volunteers, then we're just, you know, trying to include you guys in what we're doing.
Okay.
But so far, so good, knock on wood.
Any other discussion for the board?
No.
All right, I want to open it up for any public comment. I just want to remind everybody, come up to the podium, say your name and address. If you have any comments to make, please direct them through me as the chair. And please just wait to be called on and try and keep your comments brief. That's all. Yes.
So my name is Joe Rojas, 390 Hancock Street. I had 3 points to make, and the chair had recommended I do them all at once. I was kind of hoping there'd be kind of an engagement of questions and answers, but I'm not sure if that's how it works. Is it just comments and then I sit down, or?
You can make the comments you want to make. We can try
Sure,
and respond
sure.
and adapt to
So-
what is being mentioned.
Yep, so the first one is, I want to acknowledge that Ms. LaPond did a great job last meeting, acknowledging that there were some holes in communication, and that she had emphasized to try to really increase that communication to the community. The only stickling point I would make is that she made a suggestion that the conversation about a mask mandate be on every single agenda. My only concern was that is you're gonna kind of end up with like a boy who cried wolf type of scenario, where all of us are living our lives, you know, trying to go day to day. And if that's on the agenda every single month, every single meeting, we're gonna eventually get tired of it and not know when you're gonna actually vote on it. So I would suggest that maybe you don't include it on every agenda meeting, and then possibly when the time comes and Marty gives a suggestion that we should talk about it, that then you either have a special meeting or then include it on the meeting, so that if we wanna come in and participate, we can. That was the first point. The second point, which I was, you know, Marty made a big point to talk about cases, and cases come up all the time, but it's important to note that cases do not equal infection or illness, right? it's been known for a long time that the testing method used has limitations, right? There's a cycle threshold that if you exceed an acceptable limit, you're just grasping at straws, right? So to have cases without any anecdote about, not anecdote, but statistics about cycle thresholds on those cases or who the cases are is misleading at best, right? So you can get tested, so she's shaking her head no, but you can get tested at a cycle threshold of 40 and have no COVID in your body whatsoever.
Joe, I just want to remind you, please don't direct any comments at.
I'm sorry, she was shaking her head, I
Please,
apologize.
that's all I
Okay.
ask, thank you.
So all I'm gonna say is cases do not equal infection or illness. They could, but they're not necessarily. So without additional data of who's testing positive or what that cycle threshold is, it's misleading at best. And then my last point is, it's more of a thought question, right? If the board decided that a town-wide mask mandate was required, right? And this is just hypothetical, so think about it. And the entire town said, we don't want it. Would the Board of Health still vote yes? And if the answer is, well, of course we would, and we listen to the town, what is that threshold to which you would say, the people have spoken, we've heard their feedback, and we don't want a mask mandate? So those are my only 3 points, something to think about, but I'd appreciate if you have any comments on it. Thank you.
Want to save anything I have to say for last, if anybody wants to? Yeah, go ahead, Christina.
So Joe, I know you sat down, but I don't mind responding to you directly for the sake of having an open communication. I think, I'm not 100% sure if Melissa and I agreed on keeping the mask mandate on the ongoing agenda, but I do believe I might have been the person that suggested it. So I only say that because I think Melissa and I had very similar comments.
Go ahead.
Okay. So having the mask mandate on the ongoing agenda, that's something that I offered and want to see on there. My rationale behind that is we are in a pandemic, and I don't want this slipping through the cracks. I think a mask mandate is something that the board needs to discuss every time because there are certain subjective factors such as thresholds. And what I don't want to have happen is we have an outbreak of cases, we haven't been talking about a mask mandate, and then right there on the fly, we're asking questions like, what are our thresholds? What are our risks? What do we need to consider? To me, it seems an issue we need to be continuously and ongoing informed about so that when something does happen, we're not making some knee-jerk reaction, throw a mask mandate. I want it to be like a continuing education topic of conversation. The other thing is I do want people in Abington to come to us as new information comes out every week about a mask mandate and say, hey, listen, you guys have this mask mandate on the agenda every week. We just got a report yesterday, the day before, last week. Masks do X, Y, and Z. Here's a clinical report. Here's something new. If we don't have it on the agenda, we don't have an opportunity to have this information being presented timely. So that's my rationale. Now, you can disagree with it. I'm not saying that I'm
Do you understand my rationale?
Yes, I do. It's just, I understand what you're saying about,
Value?
what's that?
But that's of no value?
Well, we are as board members in our position to make a judgment call, and that's what I'm doing, and that's my rationale for making it. It doesn't mean that I don't understand your point of view or I'm not listening. I'm just providing you the information behind the decision. With cases not equaling infection, case rate is a parameter that we do use to make judgment decisions. I am not exactly sure what you mean by a psychothreshold. Do you mean like a physiological threshold?
No, see, that's interesting you say that, right? So that tells me you're not aware of the testing methods that they're using, and you're just reading the headlines, cases, right?
No, that doesn't mean that, sir. That means I'm asking you to provide additional information.
So the Rt Pcr test has
Okay.
a value in which, are you familiar with how it works?
Joe, can I ask if you're going to, just so that the
Yeah,
viewers
yeah.
at home can hear, I apologize
Yeah,
for that.
sure, yeah.
Thank you.
So are you familiar with how the Rt Pcr test works?
I read the latest information. Go right ahead, Joe.
Is that a no?
I'm not sure what information you're going to present. If I'm taking
No,
information.
just how the test works.
Yes, sir. I'm aware. Please continue.
So it is designed to amplify a particular sequence in a sample. And the cycle threshold is the number of times it amplifies that sample.
Okay.
And it's not a linear, it's a logarithmic exponential. So when you reach cycle thresholds, which the consensus has been anything over 28 is insignificant. However, we've been using, the whole entire country has been using cycle thresholds 35, 39, 45 in the UK, you are magnifying something that was almost never there in the first place.
Okay.
So like, if I were to get a COVID test, I would want to know what is that cycle threshold, right? People have been tested positive with 20, that's an illness. 45 is not an illness. It's just
They are active cases, sir. I think what we're presenting is number of active cases.
based
which
on
is the
what?
parameter.
Based on what?
Chris, I'm not trying to sound funny about this, but an active case is, as I understand it, an active COVID test. If you have an active COVID test, we're considering that an active
Yeah,
case.
and that's, sorry to cut Chris off, but that's the issue, right? An
Right.
Rt Pcr test is not binary. It's
Mm-hmm.
not, we ramped it up to 45, we found something, therefore the person's sick, right? Even the CDC acknowledges that above 28 is inconsequential.
Okay,
So when we're talking about the Rt Pcr test, which it even gets worse when you talk about the rapid test, because the rapid test is generally accepted to be not as accurate as the Rt Pcr test, right? So if we don't know the CT value of these tests,
right,
it's informational at best, but
Okay.
shouldn't be used from a standpoint of whether or not we have 40 people in in Abington that are sick.
it seems like, let me paraphrase this back to you to make sure I'm understanding what you're saying, and if I'm not, correct me
Sure,
before we
no.
move on.
Yeah.
So it seems like what you're saying is that the way that the testing is being done at the technological level, where you
Mhm.
have someone measuring the results,
Mhm.
that the way that they're measuring the results in the clinic is, how do I say it, not accurate, and that's inflating the number of, probably not the number of cases, but the seriousness of the cases?
Not inflating the numbers, because I don't want to get into that, but
Okay.
yes. Yes, if you're using an Rt Pcr test and you do not know the cycle threshold value,
Right,
it's informational at best, but should not be used as a case for us to consider.
okay.
Right, and so this has been known, right?
Mhm.
It's been widely known since, say, April of 2020. And the New York Times had an article about it in August of 2020, saying that you may have had a positive test and you probably, there's a chance you should not have. And what they did in their analysis, and this is, again, the New York Times, not me talking about some crazy stuff, that 90%, 90+% of Massachusetts cases in July of 2020 would not have passed a threshold to say they're positive, right? And so
Okay.
the fact that we're talking about this now is, my point I made on Facebook was that, you need to know the information that is contradictory to what we're hearing. Not
Okay.
saying it's right, but it's important to know the contradictory information.
I'm not saying it's right either, but I think it's definitely something, it's a valid point. I don't know in which case Joe and I can connect
Well,
the information to.
I want to piggyback off that and say that the things and information like that are something that obviously Marty is the person and the point person to understand what is information, what type of tests are being used for our specific scenario. And he is our agent, and we get our information from him, and I am willing to understand and piggyback off of that and agree with him on those pieces of information. And I wouldn't expect any member of this board to know what exactly is being used in Abington, but what is important here is that we have this discussion about this particular thing so that we can ask those questions. I don't remember receiving an email or anything about this particular thing, and not that it's everybody's job to email us every single time that there's something, but it's helpful for us to have that information in hand from people that feel those concerns, and have people come to these meetings and discuss this. Unfortunately, we're at a bit of a disadvantage because the person who has this information isn't here right now.
And,
So
and to be fair, I don't
Yeah.
suspect Marty is aware either, because, to his point, he's got a lot on his plate, right? And he's pulling numbers from the state. And this was brought up to the state, I would say, maybe like July, September of 2020. And quite frankly, they said, yeah, not every test is perfect, but then they moved on. So I wouldn't expect Marty to know either. I'm just bringing it up that if you're not aware of how the Rt Pcr test works, it might just be worthwhile to take a look at it, right? Because, you know,
Sure.
it is what it is. It's a highly technical test, not designed to prove whether someone's ill or not. It's designed to magnify what's in their sample.
I agree with that. I'm open-minded. I'm going to look at it. We are under the direction of the state of Massachusetts. If they have independently looked at this issue and said that the townships need to respect the case numbers under these technical ways of measuring, I don't believe we might have the authority or scope to overturn it.
That's fair.
But you bring up a good point.
That's fair.
And I think on my side, I'm completely willing to look into it. But Joe, I probably do need to connect with you after this meeting to
Sure,
get some
yeah.
of your resources down, because I don't think I'm going to remember this off the top of my head, the sites you've referenced,
Yeah, if
okay?
you just go to the New York Times and search, was your PCR test positive? It may not have been. You'll find the article from August 2020.
Well, I'd love to look at the same information you're
Sure, yeah.
referencing, so
Yeah.
that we can talk about apples to apples.
Okay.
Christine, I don't have to cut you off, but I just want to make sure
Okay.
everybody gets a chance to talk. Melissa, Kevin?
I just think any decision we make on masks, it's going to be based on the data. I think, you know, obviously the data that we have is going to be accepted from what comes down from the CDC to the state and then to the town. I mean, that's how we'll probably be moving forward. But I think as the numbers go up, and it will be based on the recommendation of Marty and what he feels is best for the town of Abington, that's the direction that I would go in.
Yeah, and that was my point, is that I understand that, right? You guys are under pressure from the state because who is the town of Abington to question the state? I get that, but if each of you were aware of, you know, some of the contradicting information, you could still vote against it, right? Knowing full well that you couldn't overturn the state, but at least it just shows a signal to the town that you're aware of what's going on.
Right.
I don't think we're afraid of going against the state. We actually did in the past. But I will say this, I'm also not afraid of going with the state. If after an independent look at this, we side with them.
That's
So-
fine.
And as I said, I mean, any decision would be based on the data. And if the cases continue to rise, and if they get to a level that's serious, then I think at that point in time, I think the board would have an obligation, you know, to protect the safety and health of the town. You know, I've personally, you know, my whole family at this point has just gone through getting COVID. You know, I got it from my 89-year-old mother, you know, so it's, I'm, you know, obviously I've passed my quarantine and all that, but, you know, and she's doing well, and fortunately, everybody was vaccinated and everyone's doing well. But at the same time, I mean, it's out there, and, you know, it's, you go out to put the trash out at your mother's, you never know where you're gonna get it. But I've been very careful, I've gone to stores, I've been putting masks on and wearing masks. But at the end of the day, I mean, I think it's based on the data, it's based on the number of cases and how much community spread we're getting and we're looking at.
Yep, I understand that position.
Yes, that it was put on the agenda every meeting so that we could have a conversation about parameters. If we're going to vote on it, I want to make sure that it's not a decision that's made in the heat of a moment, but that we're really looking at data and facts. And I understand your point about, is the data valid enough to make a decision on? And we will take that under consideration. At least I will take that under consideration. I can't speak for the board.
Yeah, my point was really like, you know, so if the time comes and you do decide that now is the time to vote in a mask mandate, it would be great if the town was aware that this is the meeting, that you will actually vote on it. So if we wanted to voice our opinions, we could be here. And I just worry that having it on the agenda every single time is gonna have like I said, a boy cry wolf, right? We're gonna come, it's not gonna happen, we're gonna come, it's not gonna happen. And the one time we don't come is when it happens.
Well, I do think, you know, we're, obviously, we can kind of call a meeting any time if there is, you know, issues. But at the same time, you know, we do have a meeting every 2 weeks. That's our schedule. In the summertime, we're like every month. But I think that, you know, so you're at a little bit of a disadvantage because also there is a lag time of implementation. So if there becomes a situation where we feel that there is a need to implement a mask mandate, that there is lag time between, so we have to catch up. So if we see, like, again, a significant rise in community spread, and, you know, we have to almost project how that's going to, you know, or Marty does, and the board has to look at that data to see how that is going to be, what could happen in 2 weeks or 3 weeks, because it is going to take probably a week and a half to get a mask mandate out to the public and make it so that, you know, the public is aware that they have to wear a mask in public.
So maybe as a compromise, you keep it on the agenda, but you use at least the Facebook page to say, listen, this is the time we're actually going to vote on it.
Well-
please come down if you're interested.
To that point, the agenda is what I reasonably expect us to discuss in a meeting within 2 days of, our within 48 hours, business days. So we have it on here as a vote if applicable, because at any point, I mean, we could come to a meeting, I could have it on here as just a discussion, and anybody could make a motion and do that. It's just what I reasonably expect to have happen. Data
Yeah, but-
changes.
But I would expect that you wouldn't come to this meeting not knowing the data that Marty's going to present. Is that fair to say?
Generally, no. Generally, we do know what is going to
Yeah.
be presented.
So even if it's one day advanced, saying.
But
town
again,
event,
I can't predict that, Kevin's going to make a motion and that we're going to have this vote. I can't predict that.
Should open meeting law.
All right, so then I guess the other part is just to consider that thought experiment, right? If the entire town said we don't want it, but the suggestion was to do it, you don't have to answer it, but what would your position be? We're gonna do it anyways, or we'll listen to the town who unanimously, which is fictional, I agree, but unanimously says we don't want it, right? So think about that, because if your answer is that the entire town said no, and we would still say yes, then at that point, you're right, there's no need to alert the town you're about to vote on it. If the answer is, well, we would take into account that fictional unanimous vote to not have it, then you should have something in place to let us know that you're about to actually vote on it, so we can come down here and talk about it.
And
Does
again,
that sound fair?
I can't, it does sound fair, but I can't reasonably expect what everybody's going to vote. We discussed this on Facebook a little bit back and
Not what
forth.
you're gonna vote, not what you're gonna vote.
But
what
how
you
we're going
are
to
gonna
vote.
vote.
I don't know how everyone here is going to vote on any
No,
given thing.
that's fine, I'm not concerned about individual votes, I'm concerned with like I said, it's gonna be on the next agenda, and Marty might come and say, nope, we haven't crossed that threshold, and everybody shows up and you don't vote on it, and then 2 more pass by, and then that 4th one, Marty says now is the time during that meeting, and no one's here because we're busy trying to take care of our lives, right? Do you see what I'm trying to say? I'm trying to get a
Yes.
compromise, right?
Right.
Keep it on the agenda, but have some mechanism to say that we have crossed that threshold. Marty is about to recommend a town-wide mandate. Please come if you want to hear your voice heard.
I will say this, I'm more than happy to chat with Marty and see if there's something we can do to put out information
Okay,
that we have
that's
coming. At the same time, Marty did say at our last meeting, there are a few different things that we have in mind and when looking to see whether that's going to happen. That's a positivity rate of about 5.
Yep, you did
And
mention
that's
that.
also verifiable community spread.
Yep.
As well as a few minor factors, but those are some of the big ones. Have we crossed those thresholds yet, according to Chris's thing this
Yeah.
meeting? No.
So as citizens, we can also monitor that, I agree, right? But again, just my point is that we're all busy trying to live our day-to-day, and we're not always able to focus on what the Board of Health agenda is, so, maybe there's a compromise, I'm not saying take it off after talking to you about it, but it'd be great to know if now is the time, even if it's a day before the meeting, right, on Facebook, Abington Board of Health, we are actually going to vote on a mask mandate.
Can I ask you, Mr. Rojas, is your standing opinion you do not want it?
That's neither here nor there. I'm just simply asking to keep the town included. I appreciate the question, but it's a leading question, right? So I'm just saying, let's keep the town involved, recognizing that we're all kind of living our lives and having a hard time getting through our own lives with this COVID stuff, let alone trying to focus on what the Board of Health is going to vote on this month.
Joe, I don't want to cut you short, but I also want to give everyone else a chance
Oh,
to
yeah,
talk.
sure. Yep, I appreciate it.
Since we've had so much conversation, if we need to have some
Yeah,
people
no,
come back up,
definitely.
that's fine.
I
But
appreciate
I was
your time.
going to say one last point, though. I do think that, at the end of the day, we have I think a full vaccination rate. You said 50, but I think of the people that can get vaccinated is around 65.
67.75 is eligible
Right.
per the spreadsheet, just
Right.
about a 10 minutes
So,
ago.
so my point there is that, we have a lot of people that are not vaccinated, and I think one way to ensure that there is not a mask mandate is if we get those numbers up into the 80s or mid-80s, then I think you would have, the chances of having to have a mask mandate would be
Yeah,
minimized.
but to be fair, if we had 100% vaccinated and the test positivity went to 7, you'd probably still vote for a mask mandate, right? No, sorry, that wasn't a question, I'm just making an observation that you probably would vote for a mask mandate even if every single person in Abington was vaccinated, right? So, because the test positivity rate appears to what Marty was saying is the threshold he's working off of. So, it is what it is, right? I'm not, I'm just saying, try to keep the town involved so that when the time comes, we know we can come down here and participate in that conversation.
I do want to cut this off. We need to.
Yep, no, I appreciate your time. Thanks
Thank you,
much for
Joe.
listening.
Go ahead.
My name is Jennifer McLeod, 468 Randolph Street. In preparing to speak tonight, I went to the Board of Health Facebook page, which numbers have not been updated since September 2nd. I then went to the Board of Health website, and the same, although September 3rd, there was an emergency preparedness post put out on their website. That being the case, since we're talking about masks and we're talking about rates and everything and making decisions, and you people are making decisions for the entire town based on these rates, why isn't the town aware of the rates? Why aren't we being kept up to date? It's just a statement. It's not a question. During the height of the pandemic, Alex Haggerty kept us up to date quite often on the rates, and it gave a sense of inclusion, accountability, transparency from the Board of Health that I would like to see again. I'd also like to see, as has been recommended, a breakdown. Right now, there are 16 students in Abington that tested positive for COVID. Breakdown over the schools. The little school, the pre-K, has no cases. The others are separated out between the other schools. So 16 students are positive. I do want to, besides that was just a comment about transparency from the town, I do want to comment on the University of Waterloo study talking about the masks and how 10% of them, 10% of the masks that you're wearing, Aaron, 10% of the aerosol is trapped by those masks. 50% for the N95 traps the aerosols. The rest escapes over the nose from ill-fitting masks, from the kind that you're all wearing, not from the, none of you have an N95 or a, well, you do, okay, an N95 or a KN95. So the statistics are that the masks really don't work. Also, coming out now about mask mouth from kids being, from dentists have come out with studies saying that kids are developing teeth rot from keeping the bacteria in the mask. It's affecting their mouths 6 hours a day. You know, you get the picture. So I would like more transparency from the board. I'd like the town to be kept up to date. I'd like a say, as Joe said, I'd like to know ahead of time when you're going to vote to impose a town-wide mandate that affects every town, every person in this town, and affects all the businesses in the town. I know a lot of people that, don't want this, and we need to have say in what goes on, and we need transparency from you guys for those numbers. I don't think it's acceptable for Marty to show up a meeting with the numbers, not giving them ahead of time, and then a vote happening. There's enough confusion going on. There's enough, people mistrust. We need more accountability from our Board of Health, from our town, as to what's going on. September 2nd is not acceptable for the last update if this is such a crucial pandemic as you're talking about. So I just want to say these things. Thank you.
Yes, sir.
My name is Mike McDonald, 3 Pinecrest Road. With respect to the vaccine that you talked about earlier, Chris, the statement today it said, "It's not a lot to go on, but we do have to go on, looks great," said Kathleen Newsiel, Director of Center for Vaccine Development and Global Health at the University of Health School of Maryland. A lower dose of the vaccine in children appears as good as the higher dose in older children and adults. Pfizer's press release did not include any data on the extent to which the vaccine reduced the chances that children would become sick, Gruber said. This is the article in the New York Times. There were not enough cases of illness to tell, but outside experts said it was reasonable to assume that similar levels of antibodies would mean similar protection from disease. I mean, they gave him 10 milligrams versus 30 milligrams, and everybody's touting it as a wonder vaccine. There weren't enough illnesses. With respect to the masks, I would say, well, I think we can look to, was it Stoughton or Canton that recently put in a mask mandate without the town?
Canton.
Canton, yeah.
Okay, and that was met with huge blowback, huge. And so what they ended up doing was, which I think is ridiculous, but we're going off the CDC guidelines, which from the very get-go, I think pretty much everybody here sees the CDC as, it's been an absolute mess, and a mess. We don't know what's, like you said, misinformation you were talking about. Sometimes I feel like they know less than I do. Like that's how bad it's been, and confusing for everybody. So they went to the community, they decided that it was going to be, in order to put the mask mandate in Canton, it was going to be 10, well, the CDC for moderate cases, I believe this, you'd have to check it out. But I believe it was, they said 10 cases out of per 100,000. So Canton being 23,000, that would make what? So that would make, if you translate that, that would be what, 10, or no, it would be 6 a week or something like that? 10 out of 100,000, however that translates down. So essentially you go back to a mask mandate, which, what I'm saying is, I think universally the mask mandate is not wanted and not needed. And not needed if we look at, you know, the cases and the children particularly, the businesses, the impact. It all shows clearly that it's not something that is wanted, needed, or going to help at all. The mask, we've had masks for 18 months. And further, Boston went to, on 8/20, let me look at the numbers here. On 8/20, they went to, Boston had 819 new cases, and you can look at the number. The next 3 weeks after indoor mask mandate were 910, 996, and 948. We've been masked for 18 months. It's not working. It's clear. I mean, it's really clear. Maybe unless if you had, everybody had an N95 mask, maybe it's not gonna happen. It's just, we really need to think, it's the numbers and the people are speaking. So to slide this up, and I reiterate what my friend here was saying, was we need forewarning before these things get instituted. Because there's a big blowback here that people do not want it.
Thank you. In the interest of keeping these brief, I'm only going to allow this last comment here. We will have another chance as we have our actual mask mandate discussion, which is when I intended for us to have this public comment period. But I just want to let you know, I'm cutting this off right now after this one comment that we're going to allow so that we can continue with our agenda. Yeah.
A little bit different, more of a personal appeal. I have significant hearing loss. I also have severe tinnitus. For me, this room is full of June bugs. I have a real hard time hearing past the noise. So when I entered this room and I saw all the masks on, I knew I wasn't going to get it all. And honestly, I've probably picked up 75, 50%, 75% from you guys, 100% here. Because I use reading lips, I use facial cues that is impossible for me. So I'll just ask you from a personal side, for me, for other people in the town, probably mostly elderly, please don't put us back in communication hell. You know, we're not at the point where we need to do this anymore. Okay, thank you.
Thank you, sir.
Thank you.
All right, we are going to move on and start our mask mandate discussion. I will allow a point for discussion on this from the public again, but I do not want to miss the opportunity to get this discussion in at a reasonable time. So our next agenda item is mask mandate discussion on parameters for town-wide and vote if applicable. As I mentioned a little bit earlier, I think the two main things that Marty was discussing last week is that a test positivity around 5%, as well as community spread, were some of the thresholds we were looking for. I had none of those things, I believe, well, not verifiable community spread or a test positivity of 5, none of those have been reached quite yet. But as we can see from the active case count, that is increasing, and I think that there is an indication from the health department that it may increase over the next week.
Yeah, and I just want to mention, Marty is not here tonight. He has a class tonight, but I'm serving as his proxy, and in his opinion, current numbers do not support a town-wide mandate. And the recommendation from the health department would be to continue this discussion item for the next meeting. As I mentioned earlier, the positivity rate does appear low right now, and that will probably go back up because of the 2-week lag, but yeah, it's not recommended at this time.
Yes,
I
Melissa?
have a couple of comments. Aaron, with all due respect, I'm a little concerned about your comment when you said, I'm planning for people to speak when we have an actual mask mandate discussion. If this is not an actual mask mandate discussion, then what are you referring to?
I meant the actual discussion that the board is going to have. I want us to have our opportunity to have that so that we can work with the community, not have the community talk. Then we say something and then not allow them a chance to have a discussion at the same time. So I wanted to start this discussion and then move on to that, which is what I intended for the first place, but we had comments that were coming in.
So you're moving a point of discussion for tonight's meeting to continue the dialogue with those who are here?
I want us to begin the agenda item that we were supposed to have discussed, then allow the public to have their points, because I think it's important for them to hear what we planned on talking about on that discussion tonight.
Okay. Tonight, you don't mean a future meeting?
No, not
Okay.
at all.
Thank you.
Any other discussion from the board?
Additionally, I'd like to comment about the hearing. If anyone needs accommodations for disabilities, I would love for you to request those to the board. I actually recently got my ADI coordinator's certification for my other job in Quincy, and I'm learning what these processes are, and I hope to see them start happening here in Abington as well. So if you have accommodations that you need and you would like us to address those, please make a request to us and we will do what we can. There's CART services, there's interpretation, and there's costs behind those, and our town will have to figure out how to fund those. So thank you for your comments.
Any further discussion from the board?
On the mask mandate discussion.
Yes.
So, Chris, I'm sorry, I'm cloudy on this. One of my requests tonight is I was going to ask Marty, yourself tonight, I was going to say, have we on the health agent side, do we have firm numerical kind of parameters that say, okay, we're above the threshold or we're not? Or is it just so context driven that it's really difficult to kind of pinpoint, you know what I'm saying?
Yeah, I think as far as Marty's concerned, if we're looking at a positivity rate of 5% or higher,
Okay.
then that's the time to have the conversation, and a lot of those other factors would play into whatever recommendation that we make.
Okay. And thanks for breaking it down. I think he's mentioned this before, but there just always seems to be like context involved.
Yeah, there's a lot of moving parts.
Yeah, a lot of moving parts. So other than my explain it to me 5 comment, I'm done, Aaron.
Any other discussion, Kevin?
No, as I said earlier, I think, the decision will be based on, what Marty recommends, but also my decision for mask, but also, when we get to those thresholds and we see community spread. I think, when I was elected, I said that we would follow the science, and I will continue to do that.
Thank you, Kevin. So point of clarity, I wanted to allow us to have this discussion because I don't think it was fair that you guys were having, as the public, making comment without hearing what we had to say tonight. So I think this is a point of fairness for that. If I'm not hearing any other discussion, I'd like to open it back up for public comment if the public would like to make any more comments. Yes, sir.
Should I restate my name and address?
Sure. Yeah.
Sure, Joe Rojas, 390 Hancock. I was just trying, can we get clarification on what it means, the measure of community spread? That's all.
I think the measure is more whether or not it is happening. If we can confirm from the health department standpoint, and Chris, correct me if I'm wrong, that somebody caught COVID specifically in the school, I think is one measure of that, where if somebody caught COVID in school from somebody else, that's a measure of community spread. But if we can prove that there are members of the community catching it from each other, and that happens in an increasing number, then that is verifiable community spread, that we know that transmission is happening in our community. So it's just a whether it's happening or not, I guess, is the best answer. And Marty would be able to give you the clear answer because he's the person measuring that. That's just, as I understand it, I understand that it's a little cloudy. Yes, ma'am.
If you're basing it off community spread and talking about the schools are masked. They have to wear masks. So if it spreads in the schools, doesn't that mean masks don't work?
think it's probably a question for the health agent. We know that people and students in schools are not in schools 24 hours of the day. So this is where I think the context gets really hard. You have a student who tests positive for COVID. Did they get that in the school? Did they get that at home? Did they get that outside sports? Getting down to the root on how the spread happens and trying to target our efforts to that point instead of making like a wide assumption like, oh, it's because they're playing soccer outside. I think is where it gets to. Each case is unique.
If you base it on the evidence and not what is dictated from some other site, if you look at the Abington numbers and you base it and you look at the schools and you say, hey, everybody's fully masked in school. The percentage of vaccination rate obviously is low because most of the school students are not eligible in Woodsdale and in Beaverbrook, but at the high school they are. If it's spreading there and they're wearing masks, you're going to then require the town to put on masks to stop the spread. That does not make sense.
I want to clarify my point in meaning that that is a place that, assuming maskless, that could happen. And I'm not saying that it couldn't happen with masks too, because masks, just like everything else, are not perfect, and I understand that.
10%, remember that.
They're not perfect, but it's just an example of that. Those are types of places where we are measuring, trying to see where these sort of things could happen. It's more of an example than it is a specific, this is currently happening.
Just look at what the situation is that you're basing it on. If it's a school system, well, they're fully masked. If it's, an elderly home, well, it's higher in elderly patients. Base it on where you're getting your data from, not just generalizations. That's all I'm asking.
I can speak for a health agent who's not here, and I will say that he does do that. He takes context very importantly. He doesn't use wide assumptions, and from what I know working with Marty, he doesn't believe everything that comes through an email or website, even from the CDC. He's very thorough about doing his own assessment. So what you're speaking to about not making general assumptions, I do believe working with Marty, I can attest to the fact that he's not that type. And I, as a board member, have full faith, trust, and respect for the information he gives us. If Marty gives a recommendation to me, I believe in the Russian axiom, like trust but verify, but I do trust the information he's giving, and I'll continue to do so. But I'm open-minded to additional information if you have it.
Sir, you can approach the mic.
Sorry, Aaron.
No, not a problem.
Hi, everybody. My name is Chris Pinole. I live at 48 Loganberry Drive. We need to end the mask mandate right now. The COVID-19 virus is 4,000 times smaller than a strand of hair, which makes it very easy to pass through pretty much any type of mask. Wearing a mask is the equivalent to throwing a fistful of sand through a chain link fence. Also, after breathing through a mask for about 20 minutes, it builds up moisture, which blocks any filtering capabilities it would have, causing your breath to come out the sides of the mask, rendering it completely useless. Why is it that the rich Hollywood elites get to gather at the Emmys or the Met Gala in a tiny room full of people, but the help and our kids need to mask up? It doesn't make any sense. It feels like they are mocking us peasants. Our kids need to wear a mask, but these out-of-touch, rich, elite a-holes don't. Makes no sense. Politicians gather up without masks, but as soon as the cameras are on them, they put the masks on. It's all a show. Help us end this ridiculous mask mandate so my kids can have the freedom to breathe oxygen freely.
Thank you.
Thank you, sir. Any other public comment at this time? Yeah, go ahead.
Mike McDonald, 3 Pinecrest Road. So, David, what does your science say about masks? Like, what is the effectiveness of it? What science are you going off of?
Well, I think it's Kevin, by the way. But,
Oh, sorry,
yeah,
I'm blind.
What I would say is the CDC is like the science that you would follow. They're the ones that make
Okay,
the
so
recommendations.
the CDC, the CDC
the
director and
the
the...
State Department of Public Health would be another one that I think Marty would follow. I think
Right.
those are the recommendations that we would be looking at and following.
Okay. So the CDC director himself originally claimed that masks weren't needed, right, in community settings, and then changed his assessment.
Well,
Within-
science changes, sir.
I think he changed... Science changes?
Yeah, because
In-
we are
in-
learning about.
Really?
We are learning about how this virus
Really?
works, step
Okay,
by
it
step.
changed in 3 months.
So,
It-
look,
his
when this-
his assessment changed in 3
excuse me,
months.
Excuse me.
Okay.
We are not going to elevate this. Thank
Okay.
you. All I'm trying to say is that in the beginning of the pandemic, it was not recommended that these masks were to be used because we had a novel understanding of this virus. We have come a long way since then. It is a different understanding that we had in March of 2020.
It is,
So to
okay.
compare what the
Okay.
situation was then to now
It
is
is.
very difficult
Okay.
because of what we know compared to what we knew then.
Really? Okay. I would argue they don't know a whole lot more. They have a vaccine out, yes, but they can't treat the symptoms. They haven't treated the symptoms of it. So I don't think they don't know much. They're telling us that we have to give our children vaccines when they're pretty much 100% recovery rate. What sense you're telling me we've learned a lot, but yet we're going to force our children to be vaccinated when there's a 100% recovery rate.
I
And we're
thought-
going to put masks on them and cause more problems.
Thank you. Appreciate it.
Thank you.
Aaron?
Yeah.
May I? I just want to remind folks, there's a couple comments about ending the mask mandate for the schools. That's not under our purview currently. And so I do just want to put that out there. Thank you.
Daniel Delacourt, 1220 Washington Street. All right, so I'm against the mask mandate because, first of all, mandate is not a law, so I don't think we should all have to follow it anyway. I'm going to, but if you do, the small businesses will be affected by it because most people will probably do their shoppings online and nobody wants to wear a mask. I mean, I know we've had them on for, was it 18 months now? And a lot of us are still walking around talking. We haven't had close family members die. I'm sure some of us have, but from maybe unrelated COVID reasons. I have infection survival rates for 0 to 19, 0.00003%. This is from the CDC. That brings us to 99.997% survival rate. For 20 to 49, you have a 0.0002% with a 99.98%. 50 to 69, you have a 0.0059%. I mean, 0.005%. 99.5% survival rate. And 70 plus, you have 0.054%, which brings us to 94.6%. So we have immune systems. Our bodies still use them. I mean, this is getting just ridiculous. I mean, I myself got sick. I didn't get tested for COVID. I went to the health store, grabbed some zinc, vitamin C, vitamin D, some quercetin. I mean, it took a couple days, but I was fine. We can survive this. We can get through this together. It doesn't have to come to this. Then we have Cornell. Despite having a 95% vaccination rate on September 4th, 2021, says that they have 5 times more cases this year than they did last year. Even during the Spanish flu, people were dying more from bacterial lung infections due to mask wearing. So, I mean, we can do this. Let's work together and get this done. Thank you.
I do want to point to a study that Marty brought to us at our last meeting, which was post-acute COVID-19 syndrome. It's a focus review article talking about something really important, and that's some of the effects that happen after a COVID-19 infection. And there are things, long COVID can have things such as fatigue, cough, anxiety, depression, PTSD, palpitations. There's a lot that we don't know about what happens after a COVID infection. And for me personally to look at it, a concern that I would have is, there's a good survival rate with COVID, but what are the effects of a COVID infection that we don't fully understand yet? And that would be something that, for me, looking at whether or not types of these mitigation efforts are important is whether or not, is looking at these effects. I'm speaking, sir, thank you. Having this sort of effect is important, I think, to take into account, not just the immediate infection itself. So just my point of view here. Yes, ma'am.
Hi, I'm Mary Dayton, 60 Patterson. I appreciate the long COVID, and it has a lot of effects for older individuals, but the mask mandates are affecting the mental health of our children and our teenagers and our young adults, and it's not going to go away very soon. We need to, and I know that you guys just had a mental health thing recently, which I didn't know about because there's not a lot of communication from the Board of Health on, I don't see anything. I would like to be more informed on topics that are affecting my community. I know you guys are interested in helping people with their mental health, but we're serious problems with mental health from this pandemic and prior to that with the opioid epidemic, and it's just snowballing. We need to think at the big picture and not just all about the pandemic. It's affecting the older people. It's affecting people that have pre-existing conditions. It's not affecting the young people, and we can take steps to protect our own health if we are nervous about how it's going to affect us. We don't need to tell everybody else how to take care of their health because everyone can take care of their own health. Thank you.
I'm sorry, a quick question. If I may, I don't want to put you on the spot. You mentioned communication being better, and just a quick question, what's your primary way of preferred communication? Is it Facebook, email?
Everything and anything. And I find that it's really difficult to understand what you're saying.
I'll speak up. What is your preferred method of communication from the Board of Abington to the community to help your...
I think that any form would be helpful.
We currently do Facebook and a web page and also a LinkedIn.
I don't think that anybody's getting reached by what you guys are doing right now.
All right,
And
thank you.
I was on Facebook for, I'm not really on there a lot now, but I never see anything from the Board of Health, and I follow it. And, you know, it's...
Thank you so much. I appreciate it.
So from the Board of Health page standpoint, that is a volunteer-run page. That is just, so...
It's difficult, and it's definitely difficult right now with the pandemic, but...
So if I may, and I want to try and help solve this problem, and even if it's just minor, we have started a health department page as well. And a lot of the information, what we try to do with the Board of Health page is really just post when we have meetings and some service reminders when applicable. The health department has also put together a page for more relevant information, probably closer to the types of programs or specific numbers or information you're looking for. And that just, I believe, has changed its name to the health department page. So I would suggest that if you haven't already, go like the Abington Health Department page. We're two separate entities that work together. And that's, I know, very confusing. But follow that page. That might help get a little bit more information. Please subscribe to our Constant Contact. Those are emails that go out on a semi-frequent basis.
Yeah, we sent out an email about the mental health thing and flu clinics and vaccine clinics. So if you haven't signed up for Constant Contact, that's a great resource.
Yes.
I just have one last comment. I would suggest in future that the man with all the information is here at the meetings. It's hard with everybody saying, Marty said. I'd like to hear from Marty. I understand he had a conflict tonight, but I do think that if he's the one making the decisions at the meetings, he needs to be at the meetings.
So just to address that point, Marty is not making the decisions, he makes recommendations.
Okay, so he's
This is
making the
entirely-
recommendations, but he should...
Any mandate that comes on masks comes from this board, not from the health department.
But you get all your information from Marty, and
They
he's
get-
not here.
They get recommendations from, yeah, I understand what you're saying.
I'm just saying Marty should be here if he's the one providing this board with the information.
Yeah, and
That's my point.
what I'm serving tonight. I mean, I am only speaking directly what has come out of his mouth, but to you, he's not here to answer the question.
Exactly. So I just think if and this is a huge deal. I don't know if you people understand this. I don't know if you have kids, and I know this isn't a kid issue. I know that's been brought out of your hands, but this is a huge issue that people are dealing with. And there are many people that do not agree with what you people are doing here, what you're deciding on for an entire town without keeping the entire town informed. It's great that you have a Facebook page, it's great that they have these other things. Your website says that this meeting started at 6, but the agenda says it starts at 7. I just like more cohesive, I'd like more information, more transparency, and obviously more of Marty, if he's making the decisions.
The town website is in the process of being updated as well. That's an ongoing issue that is interdepartmental. It's not just us, so, of course, and I appreciate that.
It looks bad, it makes us doubt, it makes us question. There's been a lot of canceled meetings, there's been a lot of rearranging. It just gives us all pause with everything else that's going on nationally and around the world. It just adds a layer of mistrust we don't need. It's already hard to trust.
And certainly, when in doubt, please reach out to any of us. I know that at least 3 of us have our emails out on the town website. Like, please reach out to us. We want to get the information to you if we can.
Well,
You know.
that's great, that would be great to get. Moving forward,
Yep.
please do that.
Yep. You, and then you can hop up right after.
My name is Andrew King. I live at 493 Hancock Street. You said that the number was 5 for community spread to vote on a mask mandate. Am I correct in that?
That's positivity rate.
Positivity rate. And part of that positivity rate is knowing who's positive? Am I correct in that? Who's positive, their gender, their age, and all that? Is that part of it?
I don't want to speak in terms of it over Chris here, but I think my understanding is it's just the number 5% is what we're looking at. It's not where the, on top of
Okay.
if we have community spread, which is another consideration, but it's not whether or not, men, women, in a certain age bracket.
My point is, earlier you had said that you don't know who is testing positive, what their genetics are, what their gender is, what their age is. So that's where I was going with that. And as far as mask mandates, I am 1,000% against them. I work in the city of Boston. I have to take public transportation into the city. I choose not to wear a mask on public transportation. You would think that I would catch this. Mask mandates, while on the train, there's homeless people in the train stations. I work at City Hall Plaza doing the construction. There's bums everywhere. None of them have masks on. They're not dying. They're not out in the middle of the road. And I'm almost certain most of them don't have the vaccine either, because as a person that is 8 years sober, when I was a homeless bum, I wasn't going to get a vaccine. I wasn't wearing a mask. My 8-year-old stepdaughter goes to school in this town, and she asked me and my wife, who she knows we have in opposition to this, and thinks the same thing as we do. She asked us not to make a big deal for her because she was afraid to go to school without a mask on. I don't think that's right, that a little 8-year-old girl should know
Just the people
this.
that are talking, please, thank you.
He is absolutely right. It is child abuse. Please, just have transparency, because this other gentleman was right. We could all be here today. Next week, we're not here. And I'm not saying that you do, but the 4 of you could have the agenda to put the town back in masks. And we come, and we come, and we come, and then the one time we don't, you say, let's have a vote. And how is that fair to the town that has elected you guys into your positions? You work for the town. I'm begging you, don't put this town back in masks.
Thank you, sir.
Supposed to say this earlier. The data from the Johns Hopkins COVID-19 tracker for cases. So Vermont, leading the country with the highest vaccination rate of 71.30% fully vaccinated, had a 34.04 7% increase rate in the COVID-19 cases last week. Maine's another one. Maine is a state that has the highest vaccination rate at 67.92% fully vaccinated. And the records show a 100% increase in rate of COVID-19 cases. I mean, I could go down the list and it's going to keep showing us that the vaccinations, the higher they are, the more cases you're going to have. I mean, I don't know if that's what they're saying. That's what the data is pointing out. The other point I had was the 11 dangerous pathogens on masks. And bear with me with how do these come out? Yes, pneumonia, mycobacterium tuberculosis, meningitis, acanthamoebia. Yeah, I'm not. So there's a couple other ones on here that I don't know how to pronounce, and the last one was food poisoning. But there's 11 of them that are on your mask throughout the day. Just wanted to share that. Thank you.
Dan, I have a follow-up question for you.
Yes.
And if the answer is no, that's okay. But I wonder if you'd be open-minded if I would get your contact information, send you a little more information on masks. My experience, despite my young age, going on 40-ish, I was a chemical, biological sea burning specialist in the Air Force, and one of my specialties was decontamination of patients that had been exposed to items before they went to surgery. Now, that's like a decade ago, so the information has changed. But I have kept abreast of some of these things, including how masks do help keep patients safe in those types of environments. And I'd like the opportunity to supply some information to you on just a different perspective.
Okay.
I'm not saying it's right or wrong. I don't know where you're getting your information from, but I would like to have the opportunity to provide that to you for consideration.
This one.
Would you be open-minded to that?
Oh yeah, I'll take a look at it.
I'd love it if I could just get your email. I'll try not to bog you down with words that you and I can't pronounce, because I know the list is long, and it does make it very difficult for any of us to understand what they're really talking about. But it might be interesting to you, since this is a topic I can tell you really care about.
I just ask if that is the case, can you exchange that information just outside of the public setting for the sake of?
Yep,
I mean, I'll take a look
absolutely.
at that, but throughout this whole pandemic, whatever you want to call it, I've been going to work without a mask on,
Of course.
showing up to soccer games, baseball games, softball games, without a mask.
All of us are allowed to take our own experiences to make judgment calls. I only
No,
ask
I'm
if
not
you're
saying that. It
open-minded.
should be everybody's choice.
Absolutely.
That's the way it should be.
I just love the opportunity, if you're open-minded, to
Yeah.
providing you differential information. And you can make your judgment call from there. But I at
Okay.
least wanted you to have it available to you.
Thank you.
All right, thank you, Dan.
Any other public comment? Seeing none, I'm going to move on to our next item, which is a debrief of the pizza and prevention event. Melissa, turn that over to you.
Aaron, may I go back to the last agenda item first?
Oh, sure, yes.
I am also concerned about the communications. Do you have any comment about how the Facebook page started, if we've identified any policies around how we use it?
No, the
In
Facebook
the
page is, the idea of it is more to share information that we can on that page. If we can share information as a board that is available to us, that we're allowed to share, then yeah, I'm willing to do that. But at the same time, I'm a volunteer, so is everybody else that runs that page, and it's trying to get that information out that becomes a hassle on top of it. That's why I'm very grateful that Chris is working on the health department page so that we can share stuff as it comes out. But none of the information that is being requested is private, and if anybody needs it, they can always get in touch with us. So,
I'd like to ask that on our next agenda, we have a discussion about communications.
okay.
We can,
Okay, yeah, go ahead. I
Moving
was
on.
just going to
Okay.
turn that over to you.
thank you. Moving on to the debrief of pizza and prevention events. I just want to thank everyone who did come out to our event. I apologize to anyone who didn't find out about it. We did have a health department roundtable scheduled. I was waiting for the interview and it didn't happen. So that fell through, and I'm sorry for anyone who missed it. The first event will be the October 1st training which is for adults who work with youth. And I hope that people do get a chance to turn out. The link just went out via email, correct, Chris?
Yeah, on Constant Contact, and there is a link on the Health Department Facebook page as well.
And if anyone needs that, we'll be happy to email it to you. Further, just as a personal reflection on it, I felt that people were just happy to be in that room and have a place to talk openly about mental health, and without the stigma, and with an opportunity to share with each other about their struggle with mental health, and that there were resources and support and hope offered in that room that night. And I hope that the initiative will continue to move forward, and we'll have more trainings scheduled. That's primarily what Plymouth County Suicide Prevention offers, is the training, and bring more people into that process. So thank you.
Thank you, Melissa. Okay, moving on to our last agenda item. I'm sorry, is there any questions from the board for Melissa or about the event?
Thank you for organizing it.
Yeah,
also.
thank you so
Thank you for putting
much.
that together.
It is an important issue.
So our last agenda item is a discussion of logistics and conduct of remote meetings pursuant to an act extending certain COVID-19 measures adopted during the state of emergency. All members of the board should have a member of the updated guidance on holding meetings. I want to emphasize that on June 16th, an act extending certain COVID-19 measures adopted during the state of emergency was signed into law by Governor Baker, extending the some provisions of our COVID-19 suspension of open meeting law, specifically the executive order suspending certain provisions of open meeting law. So that has been extended. The two main things on this are that, one, we must allow adequate alternative means of public access to deliberations, which we have been doing through Facebook Live, which is one of the options that is provided to us through this new law, as well as it authorizes members of the public body participating in meetings remotely. So that means that not a quorum needs to be present. We can all be remote. One other thing I want to just point everyone's attention to is that what the requirements that are supposed to apply during this meeting, that's at the start of the meeting. I must announce that the members who are present, so do a roll call of who's present. All votes must be taken by roll call as well. That's something we will be doing if we are in that scenario. Members of the public body must be clearly audible to each other, so that's just on us to have a good microphone and connection. And lastly, is applicable to executive session. We typically don't have executive sessions, but if we do, I encourage you to read this section privately. There's really nothing here that we typically do, but just, that could fall into our purview. Typically, when we do a remote meeting, we will be on Zoom, and we tend to start at 6 o'clock, coordinated through Abington Cam. And this exact meeting specifications will be followed when doing so. So that's all I wanted to point out, just from a chair point of view in putting this meeting together. So open that up to discussion for the board.
My concern, Aaron, is the opportunity for public comment and how we deal with that. I think tonight is a good example of we need to be clear about when and how we're engaging with the public, even in a public setting, and people come to our meeting. We didn't have a specific place on our agenda for public comment. And I have the same concern about holding a public meeting online.
Public comment is not required by open meeting law, and that's something that's at the discretion of the board and specifically the chair. That's why it's not on the agenda, because I think it's more important to tailor it specifically to how the meeting is going, which is kind of what we've done tonight. And it is encouraged that we involve the public, and I want to do that as much as possible. And I know that's difficult in a remote meeting, which is why we have the comment feature on Facebook. I was talking with Kevin Tachi prior to this meeting about how Abington Cam would handle that sort of scenario. And we can handle having the public into a Zoom room, but it becomes a logistical nightmare in terms of trying to mute and unmute and get everything figured out. Doesn't mean we can't, it's just right at this point in time, we haven't worked that out yet between the two boards. So that's something I've been working on with Kevin for the past month now, trying to figure out a solution to, and it's an ongoing thing that we're working on. So I want to allow public participation as much as possible during those meetings. It just, we haven't done it in the past. It doesn't mean that we can't do it. It just means that we're working on trying to find the best way to do it right now. I know, kind of cloudy there, just that's kind of where we're at.
I just think public comment is one of the most important things that we can be offering right now. Some people just want to be heard.
And I understand that, and I want to allow an opportunity for people to be heard as much as possible. At the same time, I am not going to expect Kevin Tachi to go out of his way and try and do something new that he's not comfortable with until we've experimented with that enough. And that's what we're working on now. I'd like to personally think that we may be in a scenario where we don't have to go back into doing remote meetings yet, but that's dependent on some of the data that we've even been talking about tonight with masks and such.
In my role in Quincy, I'm hosting meetings, public meetings via Zoom for our Commission on Disabilities.
Yep.
And it's a non-issue of engaging anyone who wants to participate. We put the Zoom link on our agenda,
Yep.
and anyone, and that's posted publicly, and anyone who wants to participate can. And I use my own City of Quincy Zoom link. So I don't understand why we're relying on Abington CAM to make those decisions for us,
Because
and why we can't set up our own either through the Health Department or through the Board of Health.
That would be a question for Marty. I'm not sure why we haven't or haven't done so. I know that Abington CAM has been offering that so that it can be live to the community and available online very quickly. And I think that's part of the reason. It's the convenience factor that we've been doing it. It doesn't mean that it could be a discussion point with Marty and the Health Department to set that up in the future. It's just we haven't done that because it's been something for us that's a convenience for the community to get that video out sooner than later.
And that's why I asked for it to be on the agenda tonight, because we've had a difficult time having logistics conversations behind the scene because they've been shut down, as we can't have those discussions privately about logistics. And so it's on the agenda tonight so we can have those discussions.
Well, we can absolutely have a discussion about when and where a meeting's going to happen. It's just a matter of expressing opinion that we can't have in private. That was, I think, the big concern if anything was shut down in the past.
To my point, I don't think that we should be waiting on Kevin Tachi to decide when and how we're engaging the public as a board.
I agree with you. I don't think that is up to Kevin Tachi to decide, but since that is what we have to work with right now, I'm trying to use what we have and make that work until we have a solution. And if the solution is that Kevin can't handle doing that, then we will find another way around that and find a way to engage the public, but we're just not at that point yet.
So all boards in Abington are in the same situation?
All boards in Abington have been utilizing, if they're virtual, from my understanding, Abington CAM for public meetings.
And did the town manager make that decision?
I'm not sure whose decision that's been. That's just been what has been happening, and I inherited that as chair.
Chris, I understand Marty's not here and you're representing him tonight. Do you have any comment about whether or not the health department we could have our own Zoom so that we can host our own meetings?
That's not under the purview of the health department. That would be entirely,
For IT.
the Board of Health is a completely separate entity than the health department, and that decision is up to you. That does not involve us.
But my concern there would be is that is involving that's a payment thing that we don't have a budget to.
Correct, which is why
Yeah.
I'm asking if there would be support from the health department in that element.
Yeah, for a Zoom account, I mean, yeah, sure, I don't foresee a problem with that.
I'd like to make a motion that we start our own Zoom.
I'd like
Platform.
to speak to that before the motion, if possible. May I? So on this topic, before she makes a motion, I do have some unrelated reasons on why an ongoing Zoom might be beneficial to the community. I do think in-person meetings disproportionately impact certain peoples in our communities. For example, familial status, people that have homebound duties to support other family members can't easily come into meetings. Economic status, not all of our residents have transportation readily available, and it can be expensive if you're working a swing shift or a night shift. Also, minority engagement. I worked in telecommunications, and for people of minorities that we want to include, giving them an opportunity to attend remote meetings as opposed to coming in physically can be a more welcoming way to be more inclusive of different people in our community. So for myself, I like the idea of ongoing remote access. I know that I've seen hybrid systems where you can have a meeting, but people can call in remotely, because it just allows us to, I feel, be more inclusive of all of our residents. Also people that might be on military leave, FMLA, while they might be protected and work, if you're on FMLA or military leave and you're in another state, I feel like you should be able to call in, and this might be a more inclusive way. So I just wanted to vocalize my reasons for being for it and to support of it.
And this, just broadcasting our meetings has been an ongoing problem. I mean, when I joined the board, they weren't videotaped at all. This was just minutes were available. So I think if we can even just get our meetings to be live for the first time, which they haven't been, I think, ever in the time that I've been on the board, that would be a fantastic thing. I agree. I think a Zoom account of our own would be a fantastic option. And I've been trying to work with what we had going forward. So I agree. I think that if we can create the access for it, that's wonderful.
If we can.
Yeah, if we can.
No, I work in the town of Hingham, much like Melissa works in the city of Quincy, and, we do have Zoom, and we have total interaction with the community. People are able to raise their hand, and then you can kind of bring them into the meeting at the appropriate time. I do think that that's something that the town should have town-wide, and I do think, to be honest with you, I don't know, the whole IT implications and things of what they are doing.
Right.
For those, but maybe that's something that we need to do is to find out what the town is doing to solve that problem. It's something that can be solved pretty easily and pretty quickly.
Definitely. I have a motion from Melissa that the Board of Health, will you restate your motion so I can restate it properly?
Make a motion that the Board of Health requests the Abington Health Department to support us in having our own Zoom accounts.
I have a motion from Melissa that the Health Department support our request of a Zoom account for the Board of Health. Do I have a second on that motion?
I'll second the motion.
A second from Christina. Any further discussion?
The one thing, I just would like to know the process as far as where the rest of the town is, and I would just like to know, I can't imagine that, we're 18 months into this pandemic, and I can't believe that the town, doesn't have like the Zoom capability for meetings. I'm kind of surprised at that.
I'm not sure what the town in particular is using. I
Right.
know that this is what our board has been doing, and boards like them.
Right.
So I would say my only concern, if we have our own, and this would just be more of a logistical thing for me to work out with Kevin, is how would we still provide that live access on our end? On what the adequate means that are listed out. Is that going to be on our Facebook page, Abington Cam, or what? So that'd still be a logistic thing to work out. That'd be the thing to think about. But that's not my feeling either way on that. So
I agree. I think it would just be better for us to have control of our own page, and then we bring them in as co-administrators so that they can live stream it to Abington Cam. But we need to be able to have control of hosting the meeting and allowing the public to engage and having those controls.
Sure.
Thank you.
Any further discussion? Take a vote. All those in favor of the motion, please signify by saying aye. Aye. Opposed? It's unanimous. Motion passes. Is there any other points on this logistics of these remote meetings?
No.
Okay, hearing none, I would now entertain a motion to adjourn.
I'll make the motion to adjourn.
I have a motion for Kevin to adjourn.
Second.
Second from Melissa. All those in favor?
Aye.
Aye. Opposed? It's unanimous. Motion passes. We are adjourned.